Bladder cancer exposed, demystifying the silent threat and empowering solutions. Prepare to unravel the secrets behind bladder cancer as we shed light on its enigmatic nature. Get ready to unlock the knowledge you need to take charge of your bladder health or support your loved ones. Hey there, welcome back to Mind State. We're here to help you tap into your full potential and become the best version of yourself. In this video, we will uncover its hidden causes to recognize its elusive symptoms. We'll guide you through the intricate web of this disease. Before we move forward, don't forget to like the video and subscribe to our channel and tap the notification bell so you won't miss any of our uploads. What is bladder cancer? Bladder cancer, a condition that primarily originates from the abnormal growth of urothelial cells, which are responsible for lining the inside of the bladder, is a prevalent type of cancer called urothelial carcinoma. This form of cancer accounts for the majority of bladder cancer cases. Urothelial carcinoma, while a concerning diagnosis, does offer some positive aspects. One encouraging factor is that it is frequently detected during its early stages, allowing for prompt treatment and a higher chance of successful outcomes. Detecting bladder cancer early greatly increases the likelihood of effective interventions and better long-term prognosis. To understand bladder cancer, it is essential to comprehend the role of urothelial cells. These specialized cells serve as a protective layer within the bladder, helping to maintain the organ's function. However, when certain changes occur within these cells, they can start to multiply and grow abnormally, leading to the development of cancerous tumors in the bladder. Although the exact cause of bladder cancer is still not entirely understood, certain risk factors have been identified. These include smoking, exposure to certain chemicals, chronic bladder inflammation, and certain genetic predispositions. It's important to note that while these risk factors can increase the likelihood of developing bladder cancer, they do not guarantee its occurrence. Conversely, some individuals without any known risk factors can still develop bladder cancer, highlighting the complex nature of the disease. Who gets bladder cancer? Risk factors. Bladder cancer is a condition that can potentially affect anyone, but certain groups are more susceptible to developing it. One such group includes smokers, who face a considerably higher risk due to the harmful chemicals present in cigarette smoke that can damage the bladder over time. The toxins in cigarette smoke, when inhaled, can enter the bloodstream and ultimately reach the bladder, leading to an increased likelihood of developing bladder cancer. Apart from smoking, other factors contribute to the susceptibility of bladder cancer. Age is an important consideration, as the risk of developing bladder cancer tends to increase with advancing age. Men are more commonly affected by bladder cancer compared to women, although the reasons for this gender difference are not entirely clear. Exposure to certain chemicals and substances in the workplace can also pose a risk. People working in industries such as rubber manufacturing, textiles, painting, and truck driving may encounter harmful chemicals or substances that can potentially increase the chances of bladder cancer. Occupational exposure to these substances should be minimized, and proper safety measures should be followed to reduce the risk. Previous cancer treatments, such as radiation therapy or certain chemotherapy drugs, can also contribute to an increased risk of bladder cancer. While these treatments are crucial for managing other types of cancers, they can sometimes have long-term effects on the bladder and increase the vulnerability to developing bladder cancer. Chronic bladder inflammation or recurrent urinary tract infections can also play a role in the development of bladder cancer. Conditions that cause ongoing irritation and inflammation of the bladder, such as bladder stones, urinary catheter use, or untreated urinary tract infections, may increase the risk over time. It is important to promptly address and manage these conditions to minimize the potential risk. Lastly, a family history of bladder cancer can increase an individual's susceptibility to the disease. If a close relative, such as a parent or sibling, has had bladder cancer, the risk of developing it is higher. This suggests the involvement of genetic factors that may contribute to the development of bladder cancer. Symptoms of bladder cancer. The signs of bladder cancer are typically noticeable and should not be ignored. If you or someone you know experiences any of these symptoms, it is crucial to seek medical attention and consult a doctor promptly. One common symptom of bladder cancer is hematuria, which is the presence of blood in the urine. This can result in urine appearing pink, red, or even dark brown. Although blood in the urine can be caused by various conditions, It should never be disregarded, as it may indicate the presence of bladder cancer or other serious health issues. Frequent urination is another symptom associated with bladder cancer. Individuals may find themselves needing to urinate more frequently than usual, even in small amounts. This frequent urge to urinate can disrupt daily activities and may be accompanied by a feeling of urgency. Pain or discomfort during urination is also a potential symptom of bladder cancer. This can manifest as a burning sensation or a persistent ache while passing urine. Such discomfort can be a sign of various bladder conditions, including bladder cancer, and warrants medical evaluation. Back pain can sometimes be indicative of advanced bladder cancer. As the cancer progresses, it may spread to nearby tissues and organs, leading to pain in the lower back or pelvic area. If you experience unexplained or persistent back pain, it is crucial to have it assessed by a healthcare professional. It is important to note that these symptoms can be caused by other conditions as well, but their presence should not be ignored. If you or someone you know experiences any of these symptoms, it is essential to consult a doctor for a proper evaluation. A healthcare professional can perform diagnostic tests, such as urine analysis, imaging scans, or a bladder biopsy, to determine the cause of the symptoms and rule out or diagnose bladder cancer. How is bladder cancer diagnosed? One common procedure used in the diagnosis of bladder cancer is cystoscopy. During a cystoscopy, a thin, flexible tube called a cystoscope is inserted through the urethra and into the bladder. This allows the doctor to visually examine the bladder's interior for any signs of abnormal growths, tumors, or other irregularities. The cystoscope may have a light and a camera attached to it, providing real-time visualization and enabling the doctor to capture images or videos for further analysis. In addition to cystoscopy, urine cytology is another valuable diagnostic tool. This involves analyzing a urine sample under a microscope to detect the presence of abnormal or cancerous cells. The sample is typically collected through a simple urine test, and it can help identify cancer cells shed by the bladder lining into the urine. While urine cytology is useful, it may not always detect early-stage or low-grade bladder cancer, so additional tests may be required for a comprehensive evaluation. Imaging tests are also employed to diagnose bladder cancer and assess its extent. These tests can provide detailed images of the bladder and surrounding structures, aiding in the detection of tumors, the evaluation of their size and location, and the determination of whether the cancer has spread beyond the bladder. Common imaging tests used for bladder cancer diagnosis include ultrasound, computed tomography, CT scans, and magnetic resonance imaging, MRI scans. In certain cases, a biopsy may be necessary to confirm the presence of bladder cancer. During a biopsy, a small sample of tissue is collected from the bladder for examination under a microscope. This helps determine the type and grade of the cancer, which assists in developing an appropriate treatment plan. Treatment options for bladder cancer: surgery, chemotherapy, radiation therapy, targeted drug therapy, and immunotherapy are common treatment options for bladder cancer. Surgery can remove tumors through procedures like TURBT or partial radical cystectomy. Chemotherapy destroys cancer cells throughout the body, while radiation therapy uses high-energy beams externally or internally. Targeted drug therapy targets specific abnormalities in cancer cells, and immunotherapy stimulates the immune system to fight cancer. Treatment choice depends on factors like cancer stage, tumor aggressiveness, overall health, and patient preferences. The healthcare team helps patients make informed decisions about their treatment. Coping methods: what now? Receiving a cancer diagnosis or living with the fear of its return can be overwhelming and stressful. However, there are coping methods to regain control and reduce anxiety. Stay on top of follow-up tests and appointments. Take care of your physical and mental well-being through relaxation techniques and exercise, and maintain a healthy lifestyle. Seek support from fellow cancer survivors or support groups. Consider professional help if needed. Be kind to yourself and practice self-care. Remember, you are not alone in this journey. Bladder cancer is a condition that deserves our attention and understanding. By delving into its definition, causes, symptoms, diagnosis, treatment options, and coping methods, we empower ourselves with knowledge and support. Stay informed, take charge of your health, and remember to prioritize self-care. Together, let's navigate the world of bladder cancer and emerge stronger than ever before. Thanks for watching, Mind State fam. If you found this video helpful and enjoyed our content, please show us some love by hitting that like button and subscribing to our channel. We promise to keep bringing you insightful takes on anything and everything that matters. We appreciate your support and look forward to seeing you in the next video.